everybody here, but I am fed up with insurance companies making my healthcare decisions for me.
That ain't right. That ain't right. That ain't right.
Because without insulin, I die. It's life or death for me. And we know that everyone deserves quality healthcare, regardless of their race, gender, income, or zip code. That's right. But these private insurance companies have hijacked our healthcare system. That ain't right. We are here today at America's Health Insurance Plan's headquarters because they are a trade group of the world's biggest health insurance companies whose main purpose is to lobby to prevent us from ever federally regulating their actions and their profits. These corporate insurers make billions with a B, in profits every single year at our expense. They overcharge us for premiums, deductibles, and co-pays. That ain't right. They deny us the care that we need just so that they can fill their pockets. These insurance companies deny hundreds of millions of treatments every year just because they can. And the more they deny, the more money they make. We are the only developed country in the entire world with medical debt. And we're the richest country in the history of the world. That ain't right. Health insurance companies are supposed to help us with the unexpected costs of care. But instead, these corporations exploit the system, resulting in our financial ruin and our death and suffering. There is no reason why these corporations and CEOs should be making record profits during a fucking global pandemic. They raked in $238 billion in profit at the height of the pandemic while we were fighting for our lives. So we are here today to expose the greed and cruelty behind these health insurance companies which claim to be helping us. We know it's bullshit. An injury to one is an injury to all. And we will not allow these awful corporations to block us from the care that we need and the healthy lives that we deserve. We are fighting for a world in which everyone gets the care they need, when they need it, regardless of their ability to pay. These health insurance companies have called the shots for far too long. I am ready to take my power back. How about you? Do you want power? Let me hear you. Yeah, all right. So now I'm going to invite our friend Amelia up here. And Amelia is going to share with us her story about her experience with these awful insurance companies.
Hello everyone, my name is Amelia. I'm a member of Citizen Action of New York and I live in Syracuse. I want to take a moment. Oh, yeah.
You want the bullhorn?
I can.
Sure.
There you go. Hello everyone. Is this better? Okay. My name is Amelia. I'm a member of Citizen Action of New York, and I live in Syracuse, New York. I am a chronically ill individual. I had it right. Got it. also a person who's been poor all of my life, and I've been on and off Medicaid my entire adult life. I've had symptoms including chronic migraines, shortness of breath, fatigue, insomnia, and cognitive decline since I was 3 years old. Nobody could explain why I had these symptoms, and medical professionals did not believe me when I said I was experiencing these things. After fighting for 20 years, I was finally diagnosed this past October with neurocardiogenic dysautonomia. Basically, this means that the things my body's supposed to do automatically to regulate itself it doesn't do it. My heart rate, my blood pressure, it doesn't happen. I struggle every day to get basic care and medicine that I need.
That ain't right. That ain't right.
Today, I want to tell you just one example of that. As I previously mentioned, I'm chronically ill. I have chronic insomnia that started when I was just a toddler. I remember getting in trouble for not sleeping almost every night during primary school. I remember I eventually got onto a medication in adulthood that allowed me to get some sort of sleep. But 5 years ago, my Medicaid managed care plan through United Healthcare got moved over. My Medicaid managed care plan got moved over to United Healthcare. UHC said that the sleep medication I'd been on for years to manage my chronic and severe insomnia wasn't covered.
That ain't right.
The only alternative they suggested to me was a medication meant for those with acute onset of insomnia precipitated by a traumatic event that's expected to last no longer than 5 to 7 days, which is fancy speak for people that are suffering short-term insomnia due to something bad that just happened to them, and it's not supposed to happen. They're not expected to have sleep disturbances for any longer than a week. The manufacturer's website for the drug warned that it's absolutely not to be used for any longer than 1 week. But the person I was speaking to at the insurance company didn't want to hear it. Without medication, I will go days without being able to sleep. So instead of getting medication meant for sleep, I had to accept an anxiety medication that also happens to help with sleep. As a result, I've had to go off of my anxiety medication because they could combine dangerously in my system.
That ain't right.
I still wake up frequently throughout the night, and I don't get restful sleep. That insurance rep I spoke with at UHC readily admitted to knowing nothing about medications and their properties and said that they were just doing their job. And this is just one of the many examples of an insurance company trying to force their decision about my health care that's contrary to my doctor's recommendations and that would would result in negative consequences to my health.
That ain't right.
These insurance companies don't care about me. They don't care about any of us. All they care about is making as much money as possible and maintaining their death grip on our healthcare system. And I do mean death grip.
That ain't right.
The medical industrial complex wants us to think that if we can't afford our medical bills, it's because we did something wrong. But I ask you, what am I doing wrong? Am I less of a human being because I'm disabled and chronically ill?
No.
These companies have so many of us convinced that because we struggle to pay for healthcare, that we're the bad people, that it's our fault that we're suffering. They're counting on our shame to keep us silent. But I'm here to say that I won't be silent anymore. together to demand that these insurance corporations stop denying our care and that lawmakers hold these predatory companies accountable for how they are treating us. We deserve so much better. We deserve a healthcare system that puts people over profits.
United we stand, divided we fall. Your greed makes us sick. 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 Your greed makes us sick.
Thank you so much, Amelia. Everybody, show some support and love for Amelia. We love you. You're awesome. That wasn't an easy thing to do, so you were great. Now we're going to hear from our friend Nancy.
Go Nancy!
All right, Nancy with the awesome purple hair. I love it. And Nancy's going to share with us her experience about our shitty health insurance system and how it works.
I am Nancy. I worked in healthcare for over 26 years, and things were bad when I started, but they are much worse now. I worked in medical coding, billing, and collection. Not collections from patients, collections from insurance company who denied our patients' claims. I supervised 40 people, all spending hours every day filling out endless paperwork and getting on the phone to argue with insurance companies. 40 people. I took care of the cancer people who were often confused and terrorized because their treatments were being denied for some incomprehensible reason.
That ain't right.
I would reassure them, tell them to continue their treatments, and get on the phone with the insurer and fight and argue until we eventually got paid so that the patients didn't get stuck with these bills. Closer? Okay. Only in the U.S. do people go bankrupt from medical bills.
That ain't right.
For-profit healthcare is a social disease that has reached pandemic proportions. In the richest country the world has ever seen, is healthcare a privilege for the rich or the right of every citizen?
That ain't right.
The U.S. pays much more per capita than any country with national health. We pay more, but we receive far less. And why is that? Just two words: corporate greed. In 2021 alone, at the height of the pandemic, 7 health insurance CEOs' salaries, 7 people, topped $283 million, while the industry made a profit of $40 billion. How?
That ain't right.
Denying sick people's claims, that's how. Federal data shows that the health insurance companies denied more than 248 million claims last year.
That ain't right.
But less than 0.2% of people appealed them. I recently got cancer myself, and sure enough, I had to fight denials for Medicare United Healthcare Advantage. But since I'm well practiced at arguing with them, I finally got my treatment paid for. But the last thing somebody with cancer needs is the stress and aggravation trying to get the care they need paid for. In 2011, 1 out of 7 claims was denied. And with the introduction of the new AI technology they have, we can expect that number to skyrocket. The insurance companies use their profits to lobby Congress, ensuring policies that continue protecting their profit at our expense. And it ain't right.
That ain't right.
A prime example, AHIP here, the site we're visiting, represents most of the large private insurers. In 2010, they spent $85 million lobbying to prevent the passage of the Affordable Care Act. So you know they're going to fight with everything they have against any kind of national health care every step of the way.
Oh, we will be ready.
Today I'm happy to say I am cancer-free, and I am no longer fighting insurance companies all by myself anymore, because I'm here with a great team of wonderful people and with all of you And we are going to fight for our right to quality, hassle-free health care that we all deserve.
Thank you, Nancy, for sharing your experience. Learned a lot from you. And yeah, you're right, because we fight for our right to health care. All right, so next up, I want to invite Tanea up here. Where's Tanea? Tanea! Yeah! And they are going to share with us their personal healthcare stories. So let's give it up for Tanea! Yay!
Thank you so much, everybody, for being here. My name is Tanea Taylor. I'm from Hartford, Connecticut. I'm the founder and executive director at Nonprofit Accountability Group, and I'm here with Connecticut Citizens Action Group. Yeah, I'm Black and non-binary. I founded a nonprofit organization to help bring change to Black and brown communities through arts, environmental justice, and housing. I struggle with endometriosis and scoliosis. Endometriosis is a disease that leaves me in debilitating pain every day. Fever, diarrhea, fatigue, flare-ups. It's very unpredictable and I can't live with it, but I have to struggle every day. The city I live in, Hartford, is largely Black and brown, but lacks dental and oral health centers in Black neighborhoods. The providers who are in proximity do not accept Medicaid. I have to travel out of town for services by finding a ride, catching an Uber, or taking the bus. To costly dental expenses. In September 2020, I went in for what's supposed to be a filling. I sat down and was injected with numbing agent. The dentist started to drill, then suddenly stopped. They told me I needed a root canal instead of a filling. Okay, I agreed. They said it would cost over $2,000. Then they asked me how I was going to pay for it, because they wasn't going to credit it. No, I had no credit, and I did not have $2,000, and they refused to finish until I paid.
That ain't right.
So I was sitting there texting my friends, trying to find money. I'm a good fundraiser, luckily. And, you know, my friends sent me over a couple of dollars to borrow. But almost an hour passed. I was sitting there thinking that my tooth was going to unnumb with my nerves exposed, tooth open, scared as hell, head bent back, in pain, waiting for them to make a decision while they went back and forth to see other patients who could afford their care, who qualified and could afford health insurance. Exactly. Finally, my friend sent me money. I was able to finish. But before they did, they made me pull out my purse. They brought me my purse. They said, get out your wallet, swipe your card right here with your mouth open, with the numbness, with the clamping, before we even gonna finish. Sign this before we're gonna finish, because you don't have insurance. You don't deserve humanity while you're in pain. I finished the procedure, and I never went back. I said, fuck y'all. Sorry, I don't know if we're supposed to fuck, but like, no. You know, I still need dental care, but because I don't have insurance, I can't get it. And we know dental care is health care. Oral health care is health care. So I need these people, AHIP, to do what they gotta do. We are demanding health care for people. We need better.
We need better.
And we can do it. Thank you.
Tanaya, I lost you again, wherever you went. But you're beautiful, and that was amazing. I don't know, I am riled up. I'm fucking pissed. Yeah, right on. These private health insurance companies have hijacked our healthcare system. They try to shove their agenda down our throats. It's greed, it's racism, homophobia, sexism, classism, ableism, and violence. America's health insurance plans puts their profits over our lives, and that ain't right.
That ain't right.
They've been exploiting the system for far too long. We're living in a crisis, and we need to call the shots. People's Action fought alongside me to get the up-to-date medical devices and insulin, which I need and deserve to live a full and healthy life.
Yes, you do.
People's Action and Iowa CCI and myself, we stood up and we said no to my private insurer. We fought and we continue to fight for our own agenda, the people's agenda.
Yeah.
Quality, accessible, guaranteed health care for all. And all means all. It's equity. It's solidarity. It's people over profit. Yeah. So these are AHIP's, this is AHIP's agenda that they try to shove down our throats. They make us feel guilty for our sicknesses. They make us feel like it's our fault that we can't pay an arm and a leg that they charge us for the care that we essentially already paid for. And then they deny. And that ain't right. That ain't right. And they try to shove that down my throat, down people like Carly's throat, Amelia, all of us. And we're not going to take it any longer because we know that there's a better way. Right? We got our own agenda. Because the people closest to the problem are the closest to the solution. So, what are we going to do? We're going to fight back. We're going to stand up. We're going to show solidarity for everyone. Because everyone deserves health care, no matter what. People's Action and Iowa CCI stood with me when I couldn't get my insulin. And we will stand with all of you, every single one of you, when they deny you the care that you deserve. We have the power. We already have the power. We know that, right? All we have to do is stand up together, reach out, and take it back.
Power to the people.
Because we call the shots.
We call the shots.
We
call the shots. We call the shots.
So now I'm gonna let
We call the shots. We call the shots.
So I'm going to invite Carly up here now, and Carly is going to tell us about her real life fight for our agenda.
Hey, we're going to let them drink our pop. People over profits. 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 People over profits.
Alright, hi everybody. My name is Carly Morton and I'm really excited to be here today. I will be sharing about my claim denial story with United Healthcare, my insurance company. I'm 29 years old and have struggled with medical issues my entire life. I have 24 diagnosed conditions and I am currently dependent on a feeding tube due to a rare disease called neurogenic median arcuate ligament syndrome, NMALS for short. This disease affects my upper stomach by causing extreme pain compared by physicians to end-stage pancreatic cancer pain when I eat, drink, engage in physical activity, or even stand too long, among other things. The disease resulted in various different kinds of artificial feeding, including TPN, nutrition straight to your veins and heart. This led to 2 life-threatening septic infections. The infections left me with severe post-sepsis symptoms and, along with my other medical issues, a 62.1% chance of dying in the next 5 years.
That ain't right.
One of the few things I can do to increase my chances of survival is to treat the NMALS so that I can get off of artificial feeding, which will further decrease my risk of infection. Treatment will allow me to eat real food, regain strength in my body, build up my compromised immune system, and eliminate cancer-like pain. This will allow me to function a little bit better and take care of myself more easily and effectively. Stomach surgery is the only clinically significant treatment for NMALS, and the disease is so rare that I could not be diagnosed or treated back in Pennsylvania where I live. Connecticut is the closest place with a surgeon qualified enough to treat it.
That ain't right.
Unfortunately, because the surgery takes place out of state, United Healthcare denied the surgery and made it impossible for me to appeal it. This left me with debt, and the surgery would be between another $50,000 and $80,000 more. As a disabled individual dependent on disability, there's no way I could ever pay for all of that. So I had no way to get the surgery. And if the insurance wasn't going to give the okay, the surgeon was unwilling to schedule me for surgery. And I'd be looking likely at a short life spent in debilitating pain and suffering. United Healthcare made it impossible for me to actually make any progress through the appeals process. I spent countless hours calling United Health, only to be told different things and tossed around in circles, so we couldn't get anywhere. I tried everything. I cried. I became demanding. I requested supervisors over and over and over, and I never got anywhere, still sick with the same disease and pain, desperate for treatment. It was affecting me mentally and emotionally. I was terrified of being stuck with worsening pain and scared of dying early. All I wanted was just to get my treatment, and I was ready. I was ready to give up. But thankfully, People's Action found me and their Care Over Cost program. We came together and publicly fought my insurance company until previous bills were reversed and my surgery was officially approved. I will now be getting surgery on July 20th.
That's right!
But I should not have had to fight so hard just to get my basic needs met. Millions of people are denied the care they need by private health insurers. This health care system is corrupt. The insurance companies are set up this way to spend as little money as possible, even when it means someone is not getting the care that they need and deserve. I was unable to get life-saving surgery, and I have friends who are terrified they won't be able to get their insulin again. And meanwhile, the leaders of private health insurance companies like mine are making millions of dollars a year. This is disgusting. The companies profit off of us being sick, and they don't care if we ever get well. Both physical and mental health are basic human rights. No person should be scared that they can't pay for something they need to keep themselves physically or mentally healthy. No person should go into debt keeping themselves alive. Every person should have free access to high-quality health care. This is a human right, and this is why advocating for change is so damn important. Thank
Wow, that was a powerful story, and I'm angry. I'm about to angry cry right now. So thank you for being vulnerable with us, Carly. I keep losing everybody. All right, so now let's get down to business, y'all. We are ready to talk demands. Right? That's right. Because we do everything with a purpose and a vision. We fight with purpose, and we don't stop. Right? So where's Michelle? Get on up here, Michelle. Let's welcome
Michelle, yeah! People's Action!
Let's hear some demands, Michelle. I'm excited.
Hi, People's Action!
Yeah!
My name is Michelle Higgs. I'm a member of Hoosier Action from Indiana, and I'm here joining you to demand change. I know what it feels like to have medically recommended procedures denied pre-authorization, dangerously resulting in delayed care. That ain't right.
That ain't right.
I know what it feels like to have medical debt because of denied claims. That ain't right.
That ain't right.
I'm here to add my voice to the thousands of others across this nation who've had enough of paying high premiums, deductibles, and co-insurance, or whatever else they want to call it, only to be denied access to healthcare professionals and recommended treatments. Gatekeeping and profiteering at our expense must stop now.
Yeah! Not now, but right now.
AHIP claims to support an equitable, affordable, and sustainable healthcare system that allows every American to access the best possible care and live the healthiest possible life.
That's bullshit.
Sadly, there are thousands of examples like the one shared today that tell us that is not happening. In order to begin making that statement true, we demand AHIP and their member corporations to 1, stop denying our claims and leave medical decisions between patients and their providers. We want them to overturn any existing denials for treatments recommended by our medical professionals. Number 2, be transparent about denied claims and money value. Share complete details around these demand claims and denied prior authorizations by market, state, geography, gender, and race. Share the monetary value of total denied claims and denied pre-authorizations.
Yeah!
3, be transparent about how much denials drive your profits. Share the total percentage of profits taken by denying care to us, your members. Hold monthly open mic meetings. Don't be afraid. Meet with policyholders regularly to discuss problems with your insurance products. You call us consumers, you best listen to us. Number 5, put the appeals process in public hands. Relinquish ownership of and transfer over the claims and appeals process to relevant public authorities. 6, reverse care denials we present. We've done due diligence and we expect the same. Reverse the specific care and claim denials in the cases we present to you. Number 7, get ready. Get your money out of our politics. Cease contributions to politicians' campaigns, PACs, and any other entities that advocate for or against the defeat of elected officials. And lastly, stop interfering in our democracy. Cease lobbying for any policy that results in less care or allows you to deny care for your members. It is unethical to take money from policyholders that should be used to pay for our care and give it to lobbyists to advance an agenda counter to the interests of us, your policyholders.
That ain't right.
We're sick and tired of being sick and tired.
Yeah!
We've sent these demands in writing. We have a team right now presenting them in person, and we're here sharing with the public. Enough is enough. Healthcare is a human right. Fight, fight, fight.
Healthcare is a human right. Fight, fight, fight. Healthcare is a human right. Fight, fight, fight. Healthcare is a human right. Fight, fight, fight. Healthcare is a human right. Fight, fight, fight.
Healthcare.
All right. Wow. Thank you, Michelle. We're definitely showing them who is calling the shots now, all right? So now we've got a little update from Kate, who just came from upstairs. Let's give it together. Give a round of applause for Kate.
Thank you, Bree, and thank you, Michelle. Sadly, I am not coming from upstairs. I am coming from right behind you in the lobby where we were blocked from even accessing the people that we came here to deliver the letter to. We came here with a handful of people, nothing scary, to deliver their stories and our letter with our demands to their office. And they couldn't tolerate that. So we made calls, we called through the directory, the dial by name, we got Lynn, who's in charge of Medicare reform. And she reached out and got somebody from upstairs to come down and receive our letter. And their response was, we don't know who you are. We don't know what this is all about.
They will when we leave.
That's right. They will know. All they ought to do is listen up. So we delivered those demands in that letter. And we spoke to the folks inside, and guess what the working people in this building said? How can we help you? Because working people everywhere know that we are being killed every day by their members, their corporation members, who are laundering money from these corporations into the hands of elected people. Our streets. Our streets. Our streets.
Our streets. Our streets. Our streets.
So we're here today, all of us from across the country, representing over 30 states, over 1,000 people strong, to say, we will not be quiet. We will not stop demanding that you give us the care that we deserve. We are not at fault for being sick. We are sick because they make money off of it.
Yeah, man, dirty dogs.
So we will have follow-up opportunities for communication with these folks. I imagine that we'll be getting some meetings now because they said they don't know who we are, but we've been sending the letters, we've been sending the emails, we've been leaving the voicemails. I think they know now. And they're going to see us again soon. They're going to see us again soon. Whose help? Whose help? Whose help? Whose help? Whose help? Whose help? That's right.
Except for right now, we need to be a little quiet. That was a good one. All right. So, obviously, we are sick and tired of being literally sick and tired. And like we said before, enough is enough. We deserve more. We deserve better. And we will not allow anyone to tell us otherwise, right? That's right, because we call the shots. We call the shots. And we'll be back. 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 We'll be back.
We'll be back. We'll be back. We'll be back.
All right, thank you so much, everybody, for listening. Thank you, everybody, for being vulnerable and sharing and being supportive and loving. I'm going to invite Sandra up now to give us a little update on some bus things and next steps. So thank you, Sandra.
All right. We took it to the streets. Thank you all for your enthusiasm, your compassion, and your discipline. I want to give you the instructions of where we are heading next so everyone gets on the right bus. And someone's pointing that the other group is coming. Oh, they might be coming for the same announcement, but they might have had it there. So I will repeat this multiple times. Are you ready?
Yeah.
Okay, for those of you that are going with us to site visit 4, you're going to get on buses 1 directly across from me, the leadership team, bus 2 over by the fountain, buses 4 and 5 also on this block. 1, 2, 4, and 5 are going to site visit 4. If you need the accessible bus, that is bus 3, this darker bus right across the street. I think it's 18.